Okay, now this person has come in. He's agitated, combative, violent, running into oncoming traffic, has nystagmus, tachycardia, diaphoresis. And as most of you all correctly pointed out, this is pencyclidine. All right, so in first aid, at the end of psychiatry and behavioral sciences, you have a list of the different types of drugs of abuse and what they cause, and you need to know this. All right. So for phencyclidine, think of somebody who just is violent, agitated. He's just coming and beating people, has nystagmus, okay? Has a memory loss that, whatever he's doing, this crazy person act that he's doing right now, he's not going to remember it later. So he has memory loss. He is violent and he's hitting people, and he can do that because he's not even feeling anything. So there's also analgesia. All right. So remember all of these things. Let's think of somebody who's come to a hospital hitting people. He's not going to remember this tomorrow. He's not feeling the pain, and his eyes are also going all over the place. So violence, nystagmus, analgesia, and memory loss. These are quite specific things for phencyclidine. And phencyclidine is also known as angel dust. All right, so just think, I don't know, I try to make these little scenarios in my head so that I can remember things. Just think like an angel sprinkled his dust on her, and then he just got crazy and he came with the back to the hospital. He started hitting people. He wasn't feeling the pain. His eyes were going all over the place, and then the next day he had no memory of the event. So this is phencyclidine, angel dust. My things might seem a little lame to you, so you can make your own mini dramas of medicine, but I just shared one of them. Okay, now let's have a look at what a person with other things looks like. Okay, cannabis, I'm sure most of you all have seen somebody who has intoxicated on cannabis. It causes time to glow really slowly for them. There will be a little bit of redness of the eyes. There will be dry mouth, and there can either be euphoria, or some people can get really anxious. So there can be dysphoria. All right. So this patient is not having that. This person is not chilled. He is just going and hitting everybody. So cannabis people are usually chilled. All right. It's also known as weed in common parlance, or marijuana. Cocaine is another thing which is a stimulant. All right. So cocaine and amphetamine are quite similar. They're going to cause hypertension, tachycardia, dilated pupils. You can cause euphoria, dysphoria, all right? And if you take too much of it, it can also cause chest pain, angina, seizures, etc. So this patient is having signs of stimulant drugs like tachycardia or diaphoresis, but cocaine is really not going to have nystagmus or violent reckless behavior. That is more specific to phencyclidine. All right, so not cocaine. Now, GHB is a drug which is also known as GINA or local G or liquid ecstasy, which is not that easily available, and it functions like alcohol or ethanol. Okay, the patient would be like sedated and drowsy with a bit of lack of inhibition. So this is not what this patient is having. He is having nystagmus and violent behavior with tachycardia and stuff. All right, so GHB is more like an alcohol, and alcohol is going to cause depressive symptoms and disinhibition. Now, LSD is a hallucinogenic drug. Okay, so it causes auditory and visual hallucinations, flashbacks, and which are usually not very disturbing flashbacks, and depersonalization. Like, people get this feeling of being a child again, seeing colors more vividly, having really nice flashbacks. And certain people can get very anxious, and certain people can go and have panic attacks. It doesn't really screw around with your vital signs that much. Everything is mostly happening in your brain. It's very unlikely that someone will come to a hospital with an LSD overdose. All right. So phencyclidine is the correct answer.